Hey guys, Katie Kleber, nurse educator here, and I wanted to talk to you about clinical rotations for nursing students. So let's talk about what happens during them and what different kinds of rotations you might see. So when you go to clinical at a specific hospital on a unit, you have a time slot. It might be from, 7 to 1 or 1 to 7 or maybe a whole 12-hour shift. But I've found that usually in nursing school they have clinical groups where it's not a full 12-hour shift. And it's 7 or 8 of you and 1 clinical instructor. You're each usually assigned a patient, like maybe the night before you were given an assignment of a specific patient and you had to go into the hospital and go look at the chart and get information about the patient beforehand so that you can be prepared to take care of them the next day. And because there's only 1 nursing instructor, usually you're paired with a registered nurse on the unit. So let's say you're taking care of Mr. Smith in room number 1. That patient will also have a regular nurse for the shift because you probably won't be there the whole time and you're not licensed to be able to do it on your own. So you're going to be paired with this nurse and you're going to be responsible for aspects of this patient's care. Now, depending upon where you are, if you're a first-year student, you're not going to be responsible for nearly as much as someone who's finishing up their senior year. But you could be giving meds, starting IVs, doing bed baths, taking vitals, doing documentation, performing assessments, all these different things for your patient. And you likely during your clinical time will have to do something called a care plan, where you say, hey, these are the goals I'm trying to meet with this patient, and this is how I'm going to go about doing it, and you have to put it in a specific format. So your clinical instructor will have, like 7 or 8 people that they're responsible for, that they're checking in on or helping individuals or showing, talking about different things. And you're going to be working with a specific nurse usually. Sometimes your patient gets discharged or something happens where that patient is no longer clinically appropriate for you, and then you might need to change things up at the last minute. It's totally normal and it happens. So your clinical experience is likely going to be pass-fail. Many of them are structured that way, where you do your assignments, you show up, you do a good job, you're going to pass. But if you're having a tough time and you can't perform your skills the way that you need to, you might not pass. So that's kind of how they're structured. Let's talk about the different ones you could see. You're going to spend more time in places like med-surg and maybe even critical care, because those are, a very general slice of different kinds of patients, and you can see a lot of different stuff in these units. But you also will likely have some time in different specialties that coincide with the courses of your degree. So during your pediatric course, you'll probably have a pediatric clinical. During maybe women's health, mother-baby, you might be in labor and delivery. Or if you're in your behavioral health, mental health section, you likely will be in a psychiatric facility. Actually, interestingly enough, when I was doing my nursing degree, we did our behavioral health clinicals in a prison. It was very interesting to have that experience. You might also have time in a nursing home, in an emergency department, community health, perioperative areas. Maybe you might go into the OR, the PACU, pre-op. So it all depends on the classes that you have, the way it's structured, and the clinical opportunities in your area. If you are in a pretty rural area and you only have certain opportunities, that's what you got. But if you're working in a more of a urban setting, you may have more opportunities for different kinds of clinical experiences. When I did my clinicals in rural Iowa, there was no transplant ICU or burn unit for me to have any experience on at all, so I didn't get to see that in nursing school. But if you're working, if you're in downtown Chicago, that might be a little bit of a different situation. You have more specialties near you and having access to that. So that's what you can expect from your clinical rotations. If you'd like more tips and tricks on how to really get through all that, I have a few resources that are really helpful. I'll put links to them in the description of this video. One of them is a program to just really help you through nursing school. I also talk a lot about clinicals in one of my books, and then I have some various courses that are really helpful to help people get through nursing school and even those first few years out of school as well. So thank you so much and stay fresh.